Bipolar disorder is a brain disorder characterized by fluctuations in mood, energy, and the ability to act. People with bipolar disorder have intense emotional states that usually last for days or weeks, called a mood episode. These mood swings are classified as maniac or hypomanic or depressive, sad mood. People with bipolar disorder often have periods of neutral mood. With treatment, people with bipolar disorder can live a long and productive life. People without bipolar disorder also experience mood swings. However, these mood swings usually last for hours, not days. These changes are usually not accompanied by the dramatic changes in behavior or the difficulties with daily activities and social interactions that people with bipolar disorder exhibit during mood episodes. Bipolar disorder can disrupt relationships with loved ones and cause difficulties at work or school. Bipolar disorder is a category that includes three different diagnoses: bipolar 1 disorder, bipolar 2 disorder, and cyclothymic disorder. This disorder is usually hereditary. 80 to 90% of people with bipolar disorder have relatives with bipolar disorder or depression. Environmental factors such as stress, sleep disturbances, drugs, and alcohol can trigger mood attacks in vulnerable people. While the specific causes of bipolar disorder in the brain are unclear, it is believed that an imbalance of brain chemicals leads to dysregulation of brain activity. The average age of onset is 25 years. People with bipolar 1 disorder often have other mental disorders such as anxiety disorders, substance use disorders, or attention deficit hyperactivity disorder. The risk of suicide is much higher among people with bipolar disorder type 1 than in the general population. Causes of bipolar disorder. There is no single cause for bipolar disorder. Researchers are studying how some factors can cause this in some people. For example, sometimes it can be simply genetic, that is, you have it because it comes from your family. The way your brain develops can play a role too, but scientists are not sure how or why. Bipolar disorder symptoms. In bipolar disorder, dramatic episodes of high and low mood do not follow a fixed pattern. Someone may experience the same mood, depression, or mania several times before turning into the opposite mood. These episodes can last for weeks, months, and sometimes years. The intensity of the disease varies from person to person and can change over time, becoming more or less severe. Symptoms of mania, the highs: excessive happiness, hopefulness, and excitement, sudden changes from being joyful to being irritable, angry, and hostile, restlessness, rapid speech and poor concentration, increased energy and less need for sleep, making grand and unrealistic plans, drug and alcohol abuse, becoming more impulsive, less of an appetite, larger sense of self-confidence and well-being, being easily distracted. During depressive periods, the lows a person with bipolar disorder may have: sadness, loss of energy, feelings of hopelessness or worthlessness, not enjoying things they once liked, trouble concentrating, forgetfulness, talking slowly, inability to feel pleasure, uncontrollable crying, trouble making decisions, needing more sleep, appetite changes that make you lose or gain weight, thoughts of death or suicide. Bipolar disorder is treatable. It is a long-term illness that requires constant attention. People who experience 4 or more mood episodes in a year, as well as those who have drug or alcohol issues, may develop more difficult to treat types of the condition.